Hi, guys.
Hi, good afternoon, everyone.
Hello.
Hi, thank you all for joining the meeting today. I don't know, I think we should be good now.
Yeah, there's 19 participants, so we're fine.
Yeah, we're waiting for other people to join, but just for update, I'll start with if everybody received our week newsletter, so you should be able to see our agenda there. I'll start with the COVID pay. I think on the agenda, we have the COVID pay, we have the pandemic pay. We also have update for the central monitoring station. But before we start, just to do some real quick housekeeping, please, if you're not speaking, would you mind muting yourself and unmute yourself when you're speaking? That way you don't, we don't have interruption. So to start with the COVID pay, just so some of you know, I know this Omicron has become a huge problem for nurses. A lot of nurses were sick starting in November. Some of them have used their sick banks, especially some of the pregnant nurses who had to use their sick leave bank that they were intending to use during maternity. The governor is currently going to sign the COVID pay into law. What that means is the state legislators have passed the COVID pay for 40 hours for any employer of 26 plus employees. We have to meet with the county to discuss what that means for our nurses. According to what was passed from the state level, they are retroactivating on to January 1st. So the COVID pay that is passed from the state level is retroactive to January 1st, and we are asking the county to make it retroactive to November, because November is when most of our nurses were sick. We're hoping we can meet with the county soon. We're waiting to get a response from the county and have a meeting so we can meet and confirm about this, and we can then announce that to all of you. So I know we've been getting phone calls from nurses asking, hey, is the COVID pay up? No, from the county, from within the county, no, we do not have the COVID pay active for now, but we'll have it soon, hopefully by the end of the week or next week. And if you were sick starting January 1st, at least from what the state has passed, you should be able to tap into that 40 hours. And what the state is saying, this is for only people who have either COVID or somebody who's home taking care of a COVID relative. If you have the booster shot and you're sick, I think you can tap up to 24 hours, according to what was passed from the state level. So that is just an update for you all, okay? Let me look at the next on the agenda is
Pandemic thing.
so please, if you have a question about this after the update, feel free to ask the questions. For now, we'll just go ahead and talk about this. So with the pandemic pay, just so you know, the pandemic pay, aka Heroes Pay, that was sent out to all our members December 3rd. We reached out to the county board of supervisors, we lobbied just so some of you know, we currently have 3,500 plus membership. Out of that, we only have about 800 full-timers. And so in other words, we have, say, close to 2,000 of our members are either extra helping per diem or part-time nurses. So if the county only paid people by their code, and for the extra helping per diem for hours worked, we have almost over 1,000 membership who did not benefit from this that either didn't get the full amount or didn't get the amount that they earned. So we met with the Board of Supervisors, we fought for you. Yesterday, the Board of Supervisors unanimously passed a referral that will allow the county to go back and look at all the partial nurses, the partial coded nurses, hours that work, so they can get part of that $2,500. So if you work up to full time, you should be able to get $2,500 during the pandemic. So we're waiting for that to come. So just look for that. We're happy the county was able to pass that in their budget yesterday. That's almost over $1 million that's coming to our membership. So we're all happy that you guys were able to ask us to fight for you. We fought for you and we were able to accomplish that yesterday. So thanks for everybody who reached out and helped in any way, shape or form to make that happen. So I just want to send that out to you guys. I'll go ahead. Okay, now let me talk about the central monitoring room. So we've been having, this is for our med-surg nurses who worked at Valley Medicals, just so you all know. In recent, I think it's been over a year now, right, Tiffany?
Yeah.
They've been floating, asking nurses to go to the central monitoring station to help coverage, because some of the central monitoring techs either leave the job or find something elsewhere. So the nurses have been helping in that, but then some of the nurses are not comfortable doing that. They reach out to RMPA and RMPA reach out to Jill, Sue Carl, and the nursing administration, try to mitigate this. And we also file a PERB charge with the state, the Public Employee Relation Board. They are the entity that regulate labor movement in this state. So we filed a complaint to them. Last week, we got an update from our complaint. What PERB is saying this is not a complaint they can take. So in other words, they're referring back to the nursing administration to have the discussion within ourselves. So PERB did not file a complaint against the county. That doesn't mean there is a right or wrong. What it means is, this is a case we cannot take. So usually some of this complaint, when you send it to PERB will push it back, say we are not going to take this. You go figure out some way, find a way to solve it amongst yourself. And we've met with the county, we've met with management to try to mitigate this. But I guess Paul Lawrence is doing his best to make sure they hire enough techs in that unit, in that central monitoring room. So in the future, they will not be mandating nurses to be there. Instead, they were asking for volunteer. We are hoping we can resolve this, and we just want our nurses to know your fight hasn't gone in vain. The fact that you can continue to fill in your assignment despite objection form. Every time you're assigned to that room, make sure you fill up that form. That form protects you in the event that something happened and they want to blame you. The concern the nurses are having is not that they can interpret the rhythms, because it seems like that's what's been going on. The last meeting we had, I think Jill was concerned, Jill Sprout, the CNO, was concerned that she's getting some concern that some of the nurses cannot interpret the rhythm. But we made that clear to her that it's not that the nurses cannot interpret the rhythms, it's just that there are too many readings to interpret at the same time. If you're monitoring 80 monitors, that's a lot of patients that you have to interpret, and there's more chances that you might miss one, and that can get you in trouble. And that's what the nurses are concerned about. And so we hope we can continue to talk to Jill and talk to the rest of the nursing administration and Paul Lorenz, so we can advocate for these nurses to only float in that area on a voluntary basis, not be mandated. So I hope, and like I said, at the end of this update, please feel free, if you want to talk about this, we can talk about it, okay? All right, thank you.
I want to add to that, if I could, Alan, that it's, I think, important to note that in the county's response to the PERB charge, that they said that when you're working there and you're relieving the techs or you're working there in general, you are a tech. You're not a nurse. And they specifically said in there that they're not holding you to the standard of that is your patient, you're within that ratio for that patient. They, I think it's important, I guess, to mention, Alan, that it's in writing, that they said that, you know, for those that are worried about their license being impacted by this, that they were clear in their comments that you are a tech when you're in that room. As much as it's hard to turn the nurse off, which I went to the room myself and it was very challenging, that when you are there, you are a tech and you're not a nurse. You're not assigned to any specific patient. You're simply to call and delegate out. So that hopefully that alleviates the fear of some people who are worried about their license being at risk for being in that room.
And just even if you have that alleviation of fear, also remember to fill in the assignment despite objection form. And that's what we've been told in the past. Suka stated that when you're there, you're supposed to be acting as a tech, just like if you're asked to be a seater for a different unit, right? They're saying you're only there as a seater. But again, it's hard to turn off the anxiety as a nurse, knowing your skills, your responsibility. Once you're there, things can happen and you're worried that you might be held at a different standard. So still fill up your assignment despite objection form. So that way, should something were to happen, you feel protected.
All right, so next we're going to go over PTO cash out and sick leave cash out. So you should have all received email from the county about this, and then also from RNPA. So it's in section 9.7 of the MOU. A nurse's eligibility for cash out is determined by the number of occurrences of unscheduled absences, including sick leave, in the payroll year. So this basically, long story short, is February now is the time to apply for the PTO cash out for sick leave.
Or sick leave conversion.
Or sick leave conversion.
And it should be on the agenda also. You see, we put the page number just to make it easy for you. If you go back to the agenda, it's there.
Page 48
in
the contract.
So the county also sent an email on February 1st that has a direct link for you guys to be able to apply for PTO cash out or sick leave conversion to PTO.
All right, so next we want to go over the compassion campaign. Hopefully, thank you for those of you that have submitted your stories. But basically, we're launching the compassion campaign is because we know that, you know, burnout is real. We're still in the pandemic. There's staff shortages, you know, and all of our, you know, mental health is definitely, it's been a hard time. So we've been pushing with the county for increased staffing, advocated for incentive pay, COVID pay. But in the meantime, we wanted to just launch this campaign to help you guys help each other and support each other. So we really, you know, it goes until February 14th. So we have, you know, a little bit under a week, but we would really love to hear more stories of how, you know, what you've been through during this pandemic, how it's affected you, also what you do for personal care, for self-help. You know, we've received many stories of what people do. We have also encouraging pictures of things, you know, like travel to places that you like to go to, or like you like to hike, or your family or pets, anything to help, you know, to support each other to get through this. We also have a little incentive for people to participate in this campaign. We're going to be giving away 6 Burke Williams spa treatments. Sorry. And then I just wanted to share with you guys one story that was particularly just inspiring to me, just if any of you are, you know, looking for ideas. So this comes from an O'Connor nurse. And she says, the pandemic has affected me in both positive and negative ways. I do my best to focus on positive and show my gratitude wherever I can. I joined the O'Connor Wellness Committee. We've done all sorts of projects at work and with the community. With donations from family, friends, and community organizations, we gave almost 1,000 care packages to hospital staff. We've had generous local restaurants help donate meals. We've helped deliver kindness rocks and encouraging letters from local organizations. On a personal level, I try my best to keep in touch with family and friends. The unfortunate ones who have suffered through COVID, I try to send meals and care packages when I can. I also fulfilled a dream of mine and got our first family dog, Colt. I truly feel that it's all in how you approach it. COVID can be devastating or a way to bring people closer and teach one another to be more compassionate. So this is from Tammy, one of our O'Connor nurses. She's been there since 1998. And she also enclosed a really cute picture of her kids with their new puppy. So just a nice little example, how we can just encourage each other. Unfortunately, I think we don't take the time to really care for ourselves. There's lots of resources in the community. And, we mentioned it, hopefully all of you are aware that the county offers through EAP 5 free counseling sessions. And it's just really easy. You call them and you can set up an appointment. I'm not sure if they're doing in person yet, but they might do Zoom. But, we all have really hard jobs, and it's especially hard right now during COVID. So just be checking your emails. We're going to continue to send out reminders of this and also other resources that you can utilize.
And then, thank you for that. Thank you, Jane. Also, feel free to reach out to the union and recommend things that you think the union can do to better advocate for you in these difficult times. And I know a lot of people are private. They don't want to discuss. We completely appreciate and understand that. But just so you know, we're all here as family. This work is not only on you. You're not alone. Some of us, we go through our own stress. I can tell you this is not an easy job for me. Just from my own personal experience, I can tell you working at the bedside and doing this work constantly, you're advocating for people, and you know what, that comes with a price. That comes with a price, losing your friends, losing people who may perceive you. Oh, Alan's a nice guy, but now Alan is X, Y, and Z. And then also have to go to the bedside, take care of patients, and you know what our patients are going through right now during this pandemic. It's sad sometimes patients are in their room, their families are not there, sometimes they don't. There's all these regulations and these policies. So it is a stressful time for all of us. And what I usually do for me is I use gratitude as part of my way to cope. I know I'm fortunate to be in this position representing 3,500 membership. I have a great team of staff here, a great team of board members who I can call and vent to. And just find out one person that you can trust and tell your story. And don't be shy. If you want to cry about it. It's okay. I mean, if you want to vent about it, it's okay. This time, everybody has different way. And I go to the gym. I mean, for me, I don't drink, I don't smoke. So one part of my place, if you throw me in the gym, I can be there for hours on end. So that's the way I cope. And I know so many of you have a different way to cope as well. So these are trying times. Nobody should be ashamed to discuss how mental health is affecting you. Mental health, it's not something that it has become this stigma in community. Nobody wants to talk about it. And we nurses, I know we're expert in compartmentalizing our pain and emotional suffering. We shouldn't be shy just because we're caregivers so we can receive care. We should be proud to receive care. So I just want to say that to you all. Any update for me?
No, that was it. You went through them all. We covered it.
All right. So we'll open the
Questions?
discussions and stuff like that. If there's anything in the chat room.
Oh, yeah. So one of the members wrote in about the CMR room, wanting to know how many techs have been hired and completed orientation. I'm not sure if we know the official answer to that at this time, but we can follow up. And did you say CMR will only ask for volunteers now, or can we be sent because we've been oriented?
That's the goal. That's the goal. Talking to Paul Lorenz is to make sure they hire enough staffing in that area so that way, if they're asking, it's only going to be on voluntary basis. However, what SUCAL is telling us is they've been doing this for years and they're going to continue to do that. That meaning assigning nurses to that room. I think what Patty Pelkey, one of the 6 medical, she works in 6 med. I think she's an educator also in that area. She was saying it would be good to constantly rotate people there on voluntary basis so they can just learn the skills of reading monitors and reading rhythm so they can be more familiar with that versus floating them. So I think it's going to be a discussion moving forward. I think we talked to Jill. Jill needs to know, and the nursing administration needs to know, when nurses express concern, it's good to listen to them, meet them halfway, have a discussion with them and see how they can buy into whatever is it that they're trying to do. I think that's our goal moving forward, honestly.
The floor is open for you guys now if you have questions on any of the topics that we've discussed already.
Actually, I'm sorry.
Okay, go ahead.
This is Patty, actually. What
Patty,
I
sure.
said wasn't floating them there, but to do the competencies. So
Yes.
before on the tele competencies, they weren't doing them like yearly in a way that they go, part of the competency is to go to the tele room and be reacquainted with what those people do and what it looks like for them. So we better interact with them. So it was never about floating there. It was just when our nurses did benefit from going there and seeing what it looked like and felt like and have the communication process. So when they're on the floor, they can see it from their perspective. Very, very different than covering a shift and working there. Totally different things. But I was just commenting that the exposure to it is good for the nurses, not having to work there. That's a different story. I think that should be volunteer only.
Yeah, thank you. Thank you for clarifying that, Patty. Any questions, concern? The floor is open. It can be about any subject matter. It doesn't have to be specifically about the agenda. Please feel free to ask.
My other question, which I actually was thinking about, was for the COVID pay when you're sick or symptoms from vaccination. If you're a part-time employee, is that going to be prorated or is it 40 hours for anybody and everybody?
Anybody and
Or do you
everybody.
know?
The ask is not by code. It is about an employee getting up to 40 hours if they're sick. Because if you're part-timer and you get sick, you're going to get sick anyway, regardless. Who knows how long it's going to take you, right? It might take you a week. At least you should be benefiting from that, regardless of your code status.
Can you guys hear me?
Yep.
Yeah, we can hear you now, Alex.
Yeah, but that CMR room, yeah, it's consistency, guys. That's what you guys got to tell those bosses. You see, is that consistency? And that it was really sad to hear Jill, because it seems like behind doors are saying that people don't know how to read. Of course, there's people who read them better than others, but it's sad to hear that they're saying, oh, they're scared because they don't know how to read it. That was really sad. But what we hear from the nurses is consistency. There's 2 nurses that they're going into that CMR room, and the consistency have made them really good at being there. And thanks, Patty, for clarifying that. Yeah, one thing is going to go see the room when we're doing our competencies. Another thing is working in that room, because that's a whole bunch of monitors. So that's the only sad part of that last meeting, that they were making it sound this when they're sitting with each other, it's because they don't know how to read it, and that's kind of a sad. But they need to see is that consistency. That some of the nurses that they're floating there because they're injured, so they're always there. So that consistency is what makes it good. What the nurses are concerned is that they're going to be doing there every other week, and that becomes challenging and risky too at the same time. That's not with that CMR room. I have one question. What have you guys been hearing something about the 12-hour shifts that they're planning to shift some floors into 12 hours? Anything about that? Thank you.
No, I know that 4Med is the nurse the nurses drove that discussion about 12-hour shifts. So they're gonna be piloting. They just started a pilot for that, but specifically, I haven't heard anything on any other floor about that they, what was your verbiage about shifting?
Yeah, there's even passing like they're passing like a form requesting who wants to go 12 shift, 8-hour shift. But I don't know how something like that would work with our contracts.
Who's passing the forms?
I don't know. That I just barely coming back from vacation. I just saw a text. So they're making some sort of petition.
So it's your staff you're talking about?
Correct.
Yeah.
So just to give everyone on this call how 12-hour shift works. So if the unit, a specific unit wants to go 12-hour shift, and let's say we have 40 nurses in this unit, and let's say 20 of those nurses want to go 12-hour shift, they can bring that concern to the union, and they can propose that, hey, we want to go 12-hour shift. What the union will do is we'll run a survey for that department and see how many people, and we highly encourage everybody to participate in the survey to see how many people wants to go 12 versus how many people wants to stay 8 or how many people wants to do 10. At that point, the union can then bring that up to the management, and the management may have aware of that already. And then we can meet and confer about this, where we can meet with the management, labor relation in attendance, and we can mitigate and see who needs to go 12. How would, if somebody were to go 12, how would that affect somebody else? And to Tiffany's point, we can then run some pilot with that process. We can give it, say, 90 days, and let's see, and so we can clear some of the kinks. And then we can take that back and see, is this something we want to do, or is this something that's not good for the unit? And that's something operationally we can discuss, and then we can take it from there.
So in your unit, Alex, probably people have heard about what's going on in Four Medical, and 12-hour shifts are attractive to certain people, right? Whereas 8s are more attractive for others. So that's probably where it's coming from. People have expressed the interest in my unit as well. And it is in our contract, is, you know, that we could do 8s, 10 or 12-hour shifts. So, you know, just once the nurses, you know, once that information is collected, then like Alvin said, we can just talk about it to see who, you know, how we can facilitate that if people would be interested in that, help with the process.
So it is possible to change a unit to 12 hours. Wow.
Yeah.
It is possible if that's something that you want, if that's something that the unit want, yes.
Hi, this is Susie. Can I jump in and say something about that real quick?
Yes, please.
So just to calm Alex down, you don't have to go to 12s.
Yeah.
It's a choice. It's a choice. So you can stay. I'm staying 8s on Form Ed. So you don't. They're not going to change it all to 12s. I just want to put that out there.
That is correct.
Yeah, no one could be forced into that.
And
Oh,
also,
but that would be so much chaos, I think, to have 8-hour nurses, 12-hour nurses. That would be chaotic.
it is. We're already
Scheduling
hearing.
Scheduling nightmare, I'm sure. I mean, even in Alan's department where they have what, 8s, 10s, 12s, 4s, 6s, right? I'm sure it's a scheduling nightmare, even in just
Yes.
ED department, right? But
And that's why, it's like for my scheduler, sometimes I try to, the post scheduler, she has to deal with all that. And so sometimes we just try to go easy on her because it's not easy. It's not an enviable position to be, just put it that way.
I like to tag it on that. On 2Med in the history, like quite a few years ago, they used to have a combination of 8 and 12-hour shifts. So they had quite a few of them actually. And it was a floating nightmare because if they were always short, I work PM shift. So they were short at 3, and then at 7 o'clock, they want to float you somewhere else. And so that was one thing that it doesn't only affect that unit, it actually affects any units that float there. Just as a FYI that people might not think of until it's late. But I remember being really bummed when you float to that unit, and the unit was great to work at, except for just as you got the work done, they floated you somewhere else.
And it affects the job satisfaction rate also for the nurses, because
And the continuity of care, because you were only with the patient for 4 hours. So
yeah,
you
Yeah.
weren't with that patient very long.
yeah.
It's like that right now with our travelers, right? We have travelers that are mixed in with our 8-hour shifts, and we have to, when they come at 7, assign them a shift, and sometimes by 11, they're leaving to go to a different unit,
It's very similar to that, yes.
yeah, it's not ideal. And for us, at least in my unit, it's been helpful when people come at 7, because we're exhausted by the time they come, and we can just give them a team and some admissions that are coming, and it kind of takes a little load off. But there's definitely challenges, but if people want what they want, certainly it has to be tried, right? And if people want 12-hour shifts, then that's their right, just as much as the 8-hour people, right? So you have to kind of hope that you can meet in the middle somewhere so that everybody can be satisfied within their working environment.
Yeah, it's just knowing all the facts before you decide one way or the other. Sometimes people don't think of all the angles, but it's good to know the different angles, because there's a lot of advantages to 12-hour shifts. And there's a lot of nurses that are looking for units with 12-hour shifts. So there's definitely advantages to that. It's just when making the decisions as a unit that they're aware of the good and the bad.
Yeah. I used to be full-time, 8 hours full-time. And it's almost as if you live at Valley, right? You come in there, you're almost there every day. And that can be tough. So people usually for work-life balance tend to go 12 hours just because of that. But now if you're in a unit that your 12 hours going to affect somebody else's life, and the operation of the department itself with a chaotic way of making the scheduling, it can be challenging.
Yeah. Alan, so in the chat, member, about the COVID pay being 80 hours, this time it's 40, right? Last time it was 80.
Yes.
This time it's 40. And then up to 40 additional hours of paid leave with proof of positive COVID test. Is this correct?
Yes.
Yeah, so I think it's only 40 though.
It's
is
only
my
40.
understanding from this one. The previous one was different.
Yes.
And then for retroactive status, we'll get more of the details when we meet with the county and talking about what that will look like for our membership. So ideally, retroactive status would be, according to how it is now, January 1st. However, we've asked for longer, for more into the end of 2020.
So
hopefully that answers your question.
Yes. Whoever asked that question, I think it's Ron, right?
Actually, that article from was it Insider?
Yeah.
That one, it's the first part of it says, hold on, let me go to it. About the 40 hours, and then it says, but to get an additional paid leave as much as 40 hours more. So they talk about the first 40 hours that you get for COVID, recovering from side effects. And then, but to get additional paid leave as much as 40 hours more, workers may have to show proof that they or a family member tested positive. So it kind of talks about 40 additional hours in that article.
Yeah, so that's the legislative ask, right? So we don't know once it's finalized, because that's an article written by San Jose Inside.
So it's not all the full information.
Yeah, usually once this, because there might be people that legislating these things, they will compromise, and finally once it comes out as a document that the governor is going to sign, it might be different.
Gotcha.
And then once it comes to the county, also the county might decide to say this is all we can give, right? But again, we are waiting for how that's going to look like once we meet with the county and talk to them. And at that point, we'll be able to tell you guys definitively how it will affect our members. But for the COVID leave, part-timers, like part-time workers, will get a sick leave equals to the number of hours they typically work. So just so you know, you should get a sick leave equal to the amount of hours you usually work. If you work up to full time, you should be able to get the sick leave up to full time. Okay, and then it's based on if you're positive, if you have COVID, it has to be COVID related. They were very specific with this legislative document that's coming out. It has to be COVID related, or you have a family member who's COVID related as well, if you're taking care of a COVID person. Yeah.
Any other questions or concerns you guys want to bring up while you have us here?
And some of the questions that we've been talking about, just remember, 12-hour shift, any concern, we highly encourage, make sure you have that conversation with your managers as well. Get a perspective from them and see, and then if you want to clarify things with us, feel free to call us also, we can clarify that. Our goal here is to make sure we have, the union doesn't come out as some type of adversarial partner in our relationship, right? It's managers, some managers get frustrated that, hey, why do you go straight to the union? And I think whenever they get a phone call from the union, they perceive that as adversarial. And I hope that's not the case. And we hope that's not the case, because that's not our goal. Our goal is to build a partnership where we can have a relationship. I can pick up the phone call and call someone and just resolve issues. We do not have to take everything to grievance and PERB. However, the only way you protect your nurses, your membership, there are those circumstances or situations that may warrant you to file a grievance. And filing a grievance is not adversarial either. Filing a grievance is just to say, hey, we may have a different interpretation of this. Let's take it to arbitrator to tell who's right, who's wrong. Basically, that's all what grievance is. I think if I'm a manager and there's a grievance in my department, they perceive that as adversarial. That is not. Tiffany and I can have a disagreement on so many things. Now, Jen might be the expert in what Tiffany and I are arguing about. We can say, let's ask Jen to clarify that. But because the relationship, when you have a contractual relationship with any entity, in our case, we have contract with the county, we usually will select 5 arbitrators in any contract term. Those 5 arbitrators, the county will choose 2, and there will be 1 that is selected by the state, right? What that does is, if the contract language that we have is not interpreting the way we feel, then we can take it to the arbitrator, and that's all what grievance is. And the arbitrator can look at it and say, oh, Alan, I think you have a right here, and they can tell the county, vice versa. But our goal is to build a very, very cordial relationship, a harmonious relationship with the county and your manager. So we highly, highly recommend and encourage people, if you have concern within your department, talk to your manager, talk to your assistant nurse manager. And if you need a clarity to clarify issues, reach out to us. I think we hope that's the relationship we want to take forward, because it's benefit us, it benefit our membership as well in the relationship at work.
Karis, I see your message in the chat about the old 2 Main. I haven't been over there recently. It's certainly something that we can ask. They're probably using it as storage. We know that building is going to be demoed down. I don't know when. We can ask at the next administration meeting what the plan is for that building, but we know that they're supposed to knock it down. The plan was to do that and then rebuild inpatient units, med-surg units, but not sure that that's still the plan, but we can ask about that. She says it looks like a homeless encampment there, and who's responsible for cleaning it up?
It's Paul. So Paul did call. Paul Lorenz updated me sometime last year. I don't remember the specific date, but they were behind in demolition. That, as you all see, they are behind in demolition, even the parking structure by the ED. Their plan was to demolish, to bring that down and start the constructions somehow between 2023. That's going to happen. So he had called to let us know that. Now, if we're having a homeless encampment, that's a whole different conversation we need to have with them, because that's dangerous for people to work, go to home, and some people pack in that area, in those areas.
No, this is into medical in the unit.
And
The old two
homeless,
medical, no, there's no homeless. She's saying it looks like a homeless encampment because it's messy. There's a lot of stuff going on there.
and trust me, sometimes it's scary to walk past those places. So
We don't have to walk through there, but
we'll make sure we'll ask Paul about that. Paul is the right person to ask for that, but we'll ask him. Somebody sent a message or something.
Oh, she says there's old empty drinking cups, paper all over the floor, bits of water, bits of walker. Yeah, there's a lot of abandoned, even our old 3-surge overflow. I mean, there's a lot of abandoned places, and everybody's pretty much out of that building. I think at this point, Walker Wheels, she says. There's pretty much everybody's out of that building because that was the plan, to demo it down and rebuild it and create new med-surg units. Any other questions anyone has, concerns that we can bring up? We have roughly 10 minutes.
I have a question on that incentive hazard pay.
Incentive pay?
The previous incentive pay had more units included. Are they including pretty much the same units? I work in PACU and in O'Connor, and I see that's not listed on the new incentive pay.
No, it's not. They're not including all the units on this one, although we've advocated and asked for them to include all units because they are short of staff in every area. They chose to select particular units that are most impacted by COVID related, cases and patients and staffing. So unfortunately, no, PACU was not on the list this time.
But again, feel free if you feel the need. If you guys are short all the time and you're picking up and you feel that's happening, call us and let us know. Then we can have them add that on. So that's what they told us. They feel like things are getting better in those areas in terms of staffing, so no need to include those areas. But if you feel like you guys are short all the time and you're picking up, we can prove that you guys been short in picking up, so therefore we can include them.
Okay. Well, sometimes we're more short, like we have to hold beds in order to transfer the patient, and sometimes it's a big deal when you're on call and you have to hold ICU patients that we have to call in a third on-call person just to help out.
And you fill up the level of staffing form. Make sure you fill that should be on your desktop, not the walls, but on your desktop, you should have a staffing level forms. Every time you guys are short staff, fill those out, send it to us. We use that as evidence to show that you guys need the incentive pay. So we can include you guys. We can just call and have them add that on as well.
All right, thanks.
Thank you.
In the chat, there's an ask for clarification on what will be required. Proof of infection for a family member. All that was available was rapid swabs at the time. So I guess when we meet with them about the COVID and the retro and stuff, how they would basically be able to, what documentation is needed for that.
Yeah, I think in that also, just like, if there's no HIPAA violation in that, you don't want to disclose too much. As long as you have some type of evidence to show your family member is sick and then you have to care for them. But we'll clarify that when we meet with them. So Alice, thank you for asking that question. We can clarify that when we meet with them.
Any other questions or concerns? Tiffany, I've noticed royal blue outlet extensions which attach to the IV poles on many units. Why is it my unit can't get any? What department or where are you at? Because I've seen them all over our med search units at BMC, at least in my particular area. I don't know how the outlet situation is in Sobrato, if they have more plugs, but we usually only have 4 per patient bed, and that's how we tend to run out. And maybe that's why that, we've gotten them, but what unit are you at or hospital so that we can look into that? Okay, for search. So we can ask and look into that. I didn't realize that Core Search wouldn't have any over there. You have outlet trouble apparently too. Outlets are a hot commodity around here. We can ask about that. Yeah.
Been asking for those. We asked the management. They said they were coming over, but they never came. Maybe they got lost in the translation with that CMR room. Everybody forgot about it.
How long ago was that? Do you know? We can send an email today.
Probably since I want to say November. If I truly don't, but we request even send pictures to management, see if they could help us out get the devices, because they really help the nurses, from hurting their backs, plugging things in and out, because I think they're at the level of the IV pole. So yeah, we requested for those quite a while, probably in November, I think.
August. I'm seeing August on the chat. So
yeah, around there.
Yeah.
Hey, question for everyone. Did any of you receive some kind of money from the county in your bank account? A lot of people have been reaching out to me that, hey, Alan, last Friday, a lot of nurses received some weird amount in their bank account. It says County of Santa Clara, $500, Sino $200, $300 here and there. And I know a lot of people have been asking. Honestly, we were not sure whether that has to do with some people who did not receive the incentive pay on time. Make sure, and it's hard to calculate it, and people can't interpret it what it is. If you check it's not on your, by the way, you will not see it on your check stub. It will just be in your deposit. That happened last Friday.
Alan, can you hear me?
Yeah, I can hear you.
Hey, it's Maria. Just to let you know, I got the full incentive pay, the $2,500, and I also ended up getting, I don't know what it was, but it was $250 that was put in my account. I did see a pay stub that was generated. It was generated last week, and it just says miscellaneous fee $250. Like, it doesn't have hours or anything. I was curious as to what it was, if it was a payment error of some kind, but now that you mentioned, I didn't realize that other people had it too.
Yeah, other people had it. So was that, do you ever have any incentive hours that you work?
I tried, but all were denied for some reason.
So now the question is, where's that money coming from? Why? At this point, the union, we do not have answer. We are planning on reaching out to the county, because what we don't want is 2 months down the road, we don't want the county to come back and say, oh, we accidentally sent money in your account, now you have to pay for it. Just for the benefit of people on this call, and please communicate and pass that to your friends and colleagues at work as well. Every time you receive some kind of arbitrary account money in your account that the county accidentally either overpay you, the county cannot just go back to you and take it from your paycheck. If they accidentally pay you more than you're supposed to be paid, reach out to us. We can meet with the county and negotiate how much they can pay monthly or how much you can pay per paycheck. Because sometimes people spend that money and now the county suddenly take that money out of your account and you cannot pay your bills. That is a problem. So in the future that you get money in your account and the county wants, just reach out to us. We can reach the county and they can make sure maybe they can start taking, let's say if they overpay you for $1,000, we can stretch that to 4 paycheck or 5, whatever that is, we can negotiate that for you. So that way you will pay the county back and it will not affect you, okay?
So some people that got the money, the amount was pretty much what their incentive payments would have been. A lot of people had delays in their incentive payments. And so some people that I heard that received it was the amount was basically what they were missing in terms of their incentive payment. So who knows entirely what it is, honestly. And
Yeah, I'm just surprised
this
if
point.
Maria get $250, Maria didn't work any for incentive. And I have somebody who also texted me, it's like, I didn't work no incentive and I
And they
get this
got it.
money.
I wonder if it's a like an overpayment for like OPEB, the OPEB thing, or if it's like insurance
We should know.
related, or yeah.
We should know. That's why
Yeah.
I think we should be able to reach out to the county and send a blast out to our members so they are aware of this. At least that way we're at it.
Yeah, right, it must be across
And it wasn't
all,
everybody though.
because several in custody said the same thing.
Mhm.
And I told them, be careful, don't spend it.
Don't spend it.
In case it was an error, because they will take it
They're
back.
quick to come back
No,
for it.
they're not supposed to take it. They're supposed to negotiate it. Yeah, because then that way, how many nurses spend their money there? They even check their bank account, right?
Mhm.
So.
Any other questions? We have a couple minutes left.
Please feel free to let us know how you, in the future, conduct this type of meetings. If you guys want to have it every 2 weeks, monthly, if you feel like this meeting is helpful, I think it'll be grateful to get some feedback from the membership, because this is just a form of communication to you to update you all on things. And we usually send you a news update as well.